was a variety of things that happened, positive things that happened as a result of the spinal cord action plan, and we highlighted those in our report. But just to summarise, there was 4 key areas that we felt there'd been significant progress in. One was around collective action. That the positive outcomes that had come out of the action plan really demonstrate the value of having some forum for guiding collective action and establishing clear goals and for facilitating these collaborations. And so that's why we were recommending that there's an ongoing forum of some kind to help with this ongoing communication, and therefore with the positive outcomes for people with spinal cord injury. Second thing was the actual document itself. The Spinal Cord Action Plan document was a very good guiding framework and provided an explicit guide to action, really. It had been determined by a group of people who would prioritise what they thought was important. And so it was a really great way of services being able to work out what they should work on first, researchers being able to get funding for things that they felt needed to be improved. And so the document itself was really helpful. There was a number of work programs that were successfully implemented over the course of the action plan implementation period, 2014 to 2019. There was a destination policy, which was about getting people into specialist units more quickly and getting them to surgery more quickly. There was the Specialist Paediatric and Adolescent Rehabilitation Service called SPARS, and that was making sure that children and adolescents with spinal cord injury could get rehab in an age-appropriate service. There was the implementation of the New Zealand Spinal Cord Injury Registry, which is a routine collection of data across New Zealand, which is really helpful in terms of improving services and also making sure that people's needs are getting met in an ongoing way. And then there was the Attendant Care Pilot Program, which was a pilot which was looked at whether people could bring their own, well, the feasibility of people bringing their own carers into non-spinal specialist wards, and whether those personal carers could then provide the spinal cord needs in a way that was more effective and more personalised for the person with spinal cord injury. So that was piloted as well. The fourth sort of overall thing that we talked about is this positive engagement, that over this period, as a result of the action plan, there seemed to be quite some really nice positive engagement between funders and providers and different services, etc., working together to come up with some solutions that were more likely to meet individual people's needs. And we saw that also with the peer support services, where we've got New Zealand Spinal Trust and Spinal Support New Zealand working to develop a New Zealand consistent peer support service that is the same between services. So there was this positive engagement that happened. So all of these things were great, and we were really happy to report how well the action plan had supported them.